Today we're going to talk about something that can change lives, including yours. Did you know that in the United States, over 10 million people live with heart failure, often without even realizing they have this condition? And the scariest part, it can affect people of any age. But it becomes even more common in people over the age of 60. And why is that? Because over time, the heart accumulates scars. Scars from high blood pressure, from diabetes, from silent heart attacks. Heart failure is like the heart's final cry. It's when it becomes so exhausted that it starts to lose the strength to do what it's always done: pump life. But would you even recognize the signs? Stick with me until the end, because in the next few minutes, you'll discover the 10 main warning signs that your heart might not be okay, and the first one may be more common than you think. Go ahead and subscribe to the channel, because here your health comes first. But after all, what exactly is heart failure? Think of your heart as a powerful pump that never takes a day off. It works day and night, non-stop, to send blood, and with it, oxygen and nutrients, to every part of your body. But what if, suddenly, that pump started to lose its power? That's what happens in heart failure. The heart keeps beating, but not as efficiently as before. It can no longer pump blood the way it should. And when that happens, the body starts to suffer in silence. Have you ever felt an unusual tiredness? A tightness in your chest? It might be your heart trying to compensate, and it tries in several ways. One way is by dilating the left ventricle, as if it's saying, "If I grow, I can pump more blood." But that strategy doesn't always work. Another way is by thickening the heart muscle, especially in people with high blood pressure. It's like the heart is lifting more weight than it should every single day. And when that's not enough, it speeds up the heartbeat. Have you ever felt your heart racing even while resting? That could be compensatory tachycardia. As a last resort, the blood vessels constrict. But that only worsens the pressure and puts even more strain on the heart. See how the body tries to help, but sometimes ends up making things worse? And all this might be happening inside you right now, without any clear warning signs. But take a deep breath. Your body does warn you, and I'm going to explain how. Did you know that heart failure can appear suddenly? Or develop slowly over the years, almost unnoticed? Yes, it can strike like a sudden scare, or like a silent shadow that grows over time. Let's first talk about the acute type, the one that appears out of nowhere. Ever heard of myocarditis? It's an inflammation of the heart muscle, and it can be caused even by viral infections, including COVID-19. And that's not all. Heart attacks and pulmonary embolisms are also frequent causes of this sudden form of heart failure. These are serious events that require immediate attention and often catch people by surprise. But what concerns doctors the most is the chronic form, which develops slowly, usually on the left side of the heart. It's more common and more deceptive. You could have this condition and just think, "I'm getting older, that's all." But is that really the case? There are also two types that doctors classify based on what's called the ejection fraction. In other words, how forcefully your heart pumps blood. When that force is reduced, it's usually due to a past heart attack or clogged arteries. The heart loses power, like a car with a weak engine. When the ejection fraction is preserved, the heart looks strong. But it's stiff and less elastic. This often happens in people with high blood pressure, diabetes, or obesity. It's what they call a stiff heart, one that can't fill properly or relax as it should. And what about you? Do you know anyone with these conditions? Could you have had one of them and never looked into it? In the next part, we're going to talk about something that can make all the difference. The risk factors. What increases your chances of developing heart failure, and more importantly, what you can control. Stay with me. Your heart deserves this attention. Now tell me, if you knew there were things in your daily life putting extra strain on your heart, would you change something? The truth is, There are factors that significantly increase your risk of heart failure. Some, unfortunately, we can't control, but others are totally in our hands. And the sooner we act, the better. Let's start with the controllable ones, the things you can change. Have you heard that obesity puts a strain on the heart? Every extra pound makes it work harder to pump blood. And that constant effort weakens the heart muscle over time. High blood pressure is one of the biggest culprits. It literally makes the heart work under pressure, all the time. And diabetes? It damages the blood vessels, making circulation harder. In other words, heart and blood become out of sync. Another often overlooked but very important factor: sleep apnea. If you snore loudly, stop breathing during the night, or wake up tired, be careful. Sleep apnea causes small oxygen interruptions, and the heart suffers because of it. Anemia is also a risk, especially for older adults. With fewer red blood cells, the heart has to beat faster to make up for the lack of oxygen. And alcoholism? Even in small doses, long-term use can directly damage the heart muscle. Now, there are also factors we don't choose but we need to be aware of. Age, for example. The older we get, the more the heart wears down. Genetics also play a role. If heart failure runs in your family, your risk is higher. And myocarditis? Those inflammations of the heart that can appear without warning. But pay attention. There are other causes that often go unnoticed. Cancer treatments like chemotherapy. Kidney disease, which overloads the circulatory system. Congenital issues present since birth. And even Chagas disease, which still affects many people around the world. Do you identify with any of these factors? Do you know someone living with one or more of them? Now's the time to look at your health history with care and attention. Now tell me, how's your heart really doing on the inside? Have you ever stopped to think that even though it beats every day, it might be silently asking for help? The good news is that nowadays, medicine has tools that look beyond just symptoms. And the first of those tools is the echocardiogram. Have you ever had one? It's like an ultrasound for the heart. No pain, no needles, no surprises. It shows in real time how your heart is working. If it's strong or weak. If the valves are opening and closing properly. If the size of the heart is normal, or too big. Through this test, doctors assess how well the heart is pumping. Something that makes all the difference in diagnosing heart failure. But that's not all. There's also a blood test called BNP, or B-type natriuretic peptide. It might sound complicated, but its job is simple. It checks if your heart is under stress. When BNP levels are high, it means your heart is overworked, trying too hard to keep up. It's like your heart sending a message through your bloodstream saying, "Hey, I'm tired, help me out." And you know what's most important? These tests aren't just for when symptoms are already severe. They can, and should, be done as a preventive measure, especially if you have risk factors or are over 60. Do you feel more tired than usual? Have you noticed that climbing a few stairs, or even walking a few blocks has become harder? Maybe your body is trying to tell you something, that your heart isn't as well as it seems. Now, I'm going to share with you 10 warning signs that may point to heart failure, and many of them go unnoticed. Number 1. Shortness of breath, especially when lying down or doing light activities. Have you needed more pillows to sleep? Do you wake up gasping like you're drowning? Believe me, that's not just old age. It's a red flag. Number 2. Fast or irregular heartbeat. Does your heart race for no reason? Feel like it's skipping beats? It could be tachycardia or arrhythmia, your heart trying to compensate for its weakness. Number 3. Persistent cough, often with white or pink mucus. Feels like a cold that never ends? It could be fluid building up in your lungs. Yes, heart failure can cause that. Number 4. Waking up often at night to urinate. Did you know there's a name for that? It's called nocturia. During the day your body retains fluid, and at night the kidneys work overtime. If that happens to you, pay attention. Number 5. Rapid weight gain. And not from overeating, but from fluid retention. Suddenly your pants feel tight, your ring won't fit. It's your body holding on to water because your heart isn't functioning well. Number 6. Swelling in your feet, ankles, legs, or even your abdomen. Notice sock marks that don't go away? Or shoes that don't fit anymore? This swelling, called edema, is another silent sign of heart failure. Number 7. Trouble sleeping lying flat. Do you need to sleep almost sitting up? Or wake up in the middle of the night short of breath? That could be paroxysmal nocturnal dyspnea, and it needs urgent evaluation. Number 8. Constant weakness and fatigue. Simple tasks like making the bed or sweeping the floor becoming a challenge. Don't ignore it. That fatigue isn't just from aging. It could be your heart crying for help. Number 9. Loss of appetite, nausea. Do you feel full quickly even without eating much? Do you often feel nauseous or uninterested in food? This can happen because the body is redirecting blood to more vital organs, and the digestive system ends up neglected. It's another way your body shows that the heart is struggling. Number 10. Difficulty concentrating and memory lapses. Have you felt more forgetful lately? Like your mind is foggy, and it's harder to focus or make decisions. Reduced blood flow to the brain can cause these cognitive symptoms, and it may be a silent sign that your heart isn't pumping effectively. If you identified with one or more of these signs, don't panic, but don't ignore them either. They might seem small, but together they tell a story your heart is trying to share. And the sooner you listen, the better your chances of protecting your most vital organ. Remember, heart failure is not the end, but a wake-up call. With early diagnosis and proper care, it is possible to live well and even reverse some of the damage. And that's exactly why we're here, to give you clarity, information, and hope. If this content helped you, don't forget to like the video and share it with someone who might need it. And most importantly, subscribe to the channel because here your health always comes first. And here you'll always have tips on senior health. Take care of your heart. It's been taking care of you every single day, without ever asking for a break.